I'm going to talk now about so-called open-angle glaucoma, which is sometimes known as ocular hypertension. Open-angle glaucoma is the chronic condition of glaucoma when the pressure builds up inside the eye. The pressure of fluid inside the eye builds up. When this happens, the pressure pushes on the back of the eye and injures the nerves there, and gives rise to blind spots on the eye. It's more insidious than macular degeneration, for example, because the blind spots appear at the periphery of the vision, and so it's easy for these blind spots to appear without anybody really noticing that they're happening. And so anybody who has got a history of glaucoma in the family, it's worth having checkups on the eye pressure sooner rather than later to catch this before there's any permanent damage. The normal pressure in the eye is between 13 millimeters of mercury and 19 millimeters of mercury. Now, you might look up on the web or in recent books and you will see the figures of 10 millimeters for the low pressure and maybe 20 or even 21 millimeters for the upper pressure. Which is right? Well, in my opinion, 13 millimeters is about the lowest pressure that I would consider normal. Below 13, between 13 and 10, the eye still functions. In itself, it's not dangerous, but it's a pointer. It says, hey, look out, maybe there is something going on or something that will develop. You can think of it in the same way as blood pressure. There's a normal range of blood pressure, and then there's low blood pressure, which in itself is not a danger, but it might cause mild problems, or it might later on lead to more severe problems. And then the same goes for the pressure at the upper end. I would regard 19 as the maximum normal pressure. Now at 19, normally you don't get any damage. Even at 21, 22 millimeters of mercury, you don't normally get damage, but there is the potential for damage. It's a pressure where you'd say, hey, watch out. A bit like high blood pressure, you'd say, hey, watch out, keep an eye on this. But even more so do you do so in the eye, because this 21 millimeters that you're measuring is 21 millimeters in the daytime when you go to the optician to have the pressure measured. In fact, the time of day when the pressure is highest is in the early morning, between 3 o'clock and 7 o'clock, when you're lying down still in bed. In the early morning, the pressure can rise quite significantly above the pressure that you may measure in the daytime. So this means if you've got a pressure of 21 millimeters of mercury in the daytime, it might be considerably higher in the nighttime, and that might be causing damage. So take care if you see these levels. If the pressure goes any higher than that, shall we say 25, then definitely you should do something about it. 25, there's definitely the potential for damage. Once again, it doesn't mean to say that damage will definitely occur. It's like high blood pressure. If you've got high blood pressure, it doesn't mean to say you will get a stroke, but look out, it's beginning to get into the danger zone. So that's what glaucoma is. What's the orthodox treatment? The first step in orthodox treatment is to give drops to increase the outflow of fluids from the eyes. And these are ones which will influence the iris. So it pulls the iris away from the trabeculum where the fluid flows out. The next thing is to put in eye drops to decrease the secretion of fluids into the eye. The next stage after that is to do surgery to, as it were, unblock the drain. Instead of having this fine network of the trabeculum, is to make bigger holes in the trabeculum so that the fluid can drain out more quickly then. And then the next stage after that is to put a stent in the eye so that fluids going into the eye actually come out and drain through the tear duct instead. But that's quite a desperate measure and has got its own complications, of course. So these are the orthodox treatments for eye problems. It seems to me that none of these always work, and I've had patients come to me who still have glaucoma, even with the best Western medicine. I'd like to talk briefly about coming off the orthodox medicine for reducing the pressure in the eyes. Well, it's not for us to do this. This must be done in close cooperation with the person who prescribed it in the first place. If you don't have their cooperation, then it's quite a big problem. It presents the same problems as taking people off the drugs which they use for asthma, for example. One has exactly the same problem here. How do you know when it's safe to reduce the drops? Well, this must be done in cooperation with the person who prescribed them. In the rare cases when the person who prescribed them is not prepared to cooperate, then, well, first of all, you have an ethical problem, what to do then. And in my opinion, the ethical problem is resolved by saying it's up to the patient. It's the patient's responsibility to decide for themselves whether to take themselves off the drugs. But you must, of course, warn them of the potential dangers of this. And the way to do it, the way that they can take them off, is by having frequent measurements. So if they decide to reduce the dosage of their medication, then during the following 2 to 3 weeks, it's essential that they have frequent measurements of the pressure in their eye, the intraocular pressure, to ensure that it's not going up. Well, very frequently we can help. Very frequently we can wean them off their drops, or in the case when the orthodox medicine is only having a partial effect, we can help to bring down the pressure so that the orthodox medicine works properly. The success of your treatment will depend to quite a large extent on making the right diagnosis. And here I think that the syndromes of Chinese medicine are the way to understand what's going on and the way to understand what treatments the person needs and whether the treatments will be successful. So if you look at this list of syndromes, you will see it's liver yang rising, kidney weak, spleen qi deficiency, phlegm obstructing the flow of fluids, and lung qi shu. I would just like to say that I'm a practitioner, I'm not a scholar. I apologize to the scholars who are watching this because I use the term shu or deficiency or weakness interchangeably. I'm not a very good one for sticking to terminology. I apologize for this. Now, why of those? What's the pathology behind those? What's going wrong? What's going wrong is like this: that the liver yang rising, which it's always mentioned first in the Chinese texts, because the Chinese suffer a lot more than we do from liver yang rising, I would say. The liver yang rising, when that happens, the qi rises up to the head, and rises up to the eye. And with the qi comes the fluid. And so this qi rises up to the head and stays there, and that's what causes the fluid to build up in the head and the pressure to build up in the head and the eyes. In this context, it's very like high blood pressure, very similar to it. Well, all the other four patterns you see, of course, they're similar to high blood pressure, but it's in some ways easier to understand because the kidneys, the spleen, the phlegm, the lungs all have to do with the circulation of fluids in the body. Weak kidneys, if the kidneys are weak, of course, the fluids don't circulate well. In particular, the kidneys don't receive the fluids, and so because they're not draining out the fluids properly, the pressure can build up in the eye. As far as the spleen deficiency pattern is concerned, it's the malfunction or dysfunction of the transportation and transformation function of the spleen, which leads to fluids building up in the eyes. The next pattern, which is closely related to that, actually doesn't appear in the Chinese texts, but it certainly appears in Western patients, and this is phlegm obstructing the flow of fluids. This pattern is very common in Britain, which is my home country, and it's common also in other places where it's very damp. It's also common in places where damp-producing foods, such as cheese and milk and bananas, are consumed in large quantities. The final pattern is the lung qi shu, because again, the lungs are involved with the descending of the fluids. So if the lung are not functioning properly, the fluids again accumulate in the upper part of the body, and in particular in the eyes. So that's why they happen. For those of you who are more interested in the mental aspect of these, well, of course, each of these has got its own particular emotional association. The liver yang rising is to do with anger and tension and frustration and something getting in your way, and you're surrounded by fools and idiots, and it's that sort of thing. But at the same time, when you meet these people in the clinic, they're very charming. Because the liver has to do with adaptability, and so the liver type, the wood type, is very charming and adaptable. I remember being quite early on in my practice being quite taken in by this adaptability, because I thought that liver yang people should be extremely angry. Well, now I've learnt how to sense the anger rather than to ask them about it, because this after this person who taught me a lot, he was a train driver, and he came into me with a in this case it wasn't an eye problem, it was a bad back. His back was completely seized up. I thought, oh, this doesn't look like deficiency. I wonder what's going on. Is it possibly liver qi stagnation? So I said, are you angry about anything? Oh, no, I'm not angry about anything. And then I sort of gradually steered the subject round to the fact how he was reacting to a train strike. He was a train driver, and the whole, at that time, all the trains were on strike. I said, well, how are you coping with the strike? Those idiots! They don't know how to run a party in a brewery. And so, just touched that thing, but that suppressed anger was not so obvious at first sight. The kidney weak, we'll come across this pattern again and again in eye problems. Kidney weak is also sometimes known as liver and kidney weak. It's not kidney yin deficiency, it's not liver yin deficiency, it's not kidney yang deficiency either. It's just weakness. And this is a weakness that you'll see in old age. The kidney weak in old age we call it liver and kidney weak often, because the liver, when the liver becomes weak, it loses adaptability. And so old people, they don't like change. I can feel it coming on myself. I don't like staying in hotels. I like my own bed. Um, I don't like to have breakfast at a different time. I always like to have the same breakfast, and the coffee, I like it always the same. And I like to have a cup of tea in the middle of the morning. I like that, this late nights, not for me. So one loses adaptability, which of course is the function of the liver. And also you become a little bit more cautious in old age. It's not fear as such, but just more cautious and less push, less drive. And that's what you'll see in this liver and kidney week. A sort of brittleness, as it were, that you'll see in an old tree. Spleen Qi deficiency, in China they're always described as emaciated and likely to have diarrhea and so on. In the West, actually, they're more likely to put on weight. They're easily tired, don't like exercise. Appetite, well, the appetite's usually all right in the West. It's a different thing, but what you will find is that, yes, they are worrying types. They do worry. The phlegm obstructing the flow of fluids, now this is a pattern which I'd like to spend a bit more time on. It's actually a further development, or commonly is a further development, of the pattern known as lingering pathogenic factor. This is an illness which can start very early in life, maybe 2-3 years old. And it's a pattern, it arises when an illness attacks the body and is never completely cleared. And what they say is that this illness, this pathogenic factor, sits in the channels and obstructs the flow of fluids. And over a period of time, the obstructed flow of fluids transform to phlegm. And so in this pattern of phlegm obstructing the flow of fluids, you may not especially notice that the person has got any phlegm conditions. You say, do you have a snotty nose? No. Do you get bad cough? No. What are you talking about? And the reason is that their lungs are okay, so it doesn't manifest there. But what has happened also is that the phlegm, instead of being watery, instead of being loose and soft, is actually very thick. In fact, it's so thick that even if they did have weak lungs, they wouldn't be able to cough it up. So how do you know they've got it? Well, you'll sometimes know from the swollen lymph glands, or sometimes you can see it on the skin, for example. You can see the skin is like dry or powdery, and you can often see it when you look at the tongue, because when you open the mouth and look at the tongue, you'll see that the saliva there is very thick. It may be milky, or it may you may see little jelly-like blobs of saliva in the mouth, or you may see saliva forming strings between the upper part of the mouth and the lower part. So that's the phlegm obstructing the flow of fluids. And then the last pattern, lung qi shu. Well, that's very, very common pattern. Qi shu with the lung problem. There'll usually some history of lung problem, usually a chronic cough or of some kind, or certainly a cough in the past history. You may also find that they've got the so-called special lung pulse, where the pulse, you feel the pulse further along into the wrist than you really should. So normally you would expect the pulse to stop. You'd be able to feel that the lung pulse at about lung 9, but beyond the crease you shouldn't normally feel the pulse. If you feel the pulse in this area, then this is indication that the lungs have been injured. So you'll feel this on the right-hand side, means that the right lung has been injured. If you feel it on the left-hand side, it's nothing to do with the heart, it means that the left lung has been injured. So that's another pointer towards a lung problem. One other thing about the lung qi shu, these patients tend to be, well, of course they have a quiet voice, but they tend to be somewhat dreamy patients. They tend often either looking up or looking down, or a bit sort of not quite there all the time. So those are the commonly seen syndromes. I don't want to talk too much about the details or list of symptoms. You can read about the list of symptoms in any book. And also, once you know the pattern, it's usually pretty obvious what to do. The difficult thing is actually deciding really what is the main pattern. Just to run through it, the liver yang rising, if somebody is extremely angry and extremely tense, well, of course, you've got to relieve the anger and the tension. If somebody is old and timid, then you need to tonify the kidneys to build up their kidney energies. It's obvious. I'll give you an example of the kidney weak pattern. A patient I had quite long ago now, but she sticks in my memory. She sticks in my memory because she said, you know, I do get a bit frightened now. I don't feel frightened a lot of the time, but when a brown envelope comes through the front door, I feel very frightened. I don't want to open it at all. I should explain that at this time, brown envelopes were routinely used for tax demands and for utility bills. So they always meant bad news. And she was liver and kidney weak. She had some problems. She had some bone problems, and she also had some peripheral nerve degeneration, which is typical of liver and kidney weak. And I treated her. I treated with quite simple points like bladder 23, bladder 18. Again and again, I saw her weekly. After about 6 months, she was a very different person. Not only had the peripheral nerve degeneration retreated somewhat, so she could walk better, but her whole spirit was better. She was no longer frightened of those brown envelopes. Oh, brown envelopes. I open them up, see what they are, send them off to my accountant. No problem. If I haven't got any money, oh, well, who knows? I haven't got long to live. Doesn't matter too much. Her whole attitude was completely changed simply by doing very simple treatments to build up the kidneys. It's these early experiences which have led me to use very simple treatments. I think that once you realise what the pattern is, what the main thing going on for this person is, then simple treatments will be effective. So liver and kidney weak, treat the kidneys and the liver. Spleen qi deficiency, treat the spleen, tonify the spleen. It's obvious. Perhaps one which isn't quite so obvious is the phlegm obstructing the flow of fluids. This pattern, as I say, is a particularly Western pattern, and I mentioned briefly about it being part of a lingering pathogenic factor, but there are other things going on as well, and one of the things that you will find is that they have a food intolerance, and very frequently these people have difficulty in digesting wheat. So not only do you have to take them off milk and cow's products and also peanut butter, but you may need to take them off wheat. Now, why is this? Why is it that for 2,000 years the British have eaten wheat and now they can't eat wheat? The reason is that the modern strains of wheat are much less digestible than before. What you will find in practice is that people who have the thick phlegm pattern, they have this food intolerance, they have difficulty in digesting a number of things, particularly wheat. And when this happens, the wheat it transforms into phlegm and heat, something we'll come across again and again in eye conditions, something we come across again and again in Western patients. And when this happens, when the wheat transforms to phlegm and heat, it can give rise to all sorts of problems, skin problems, even as severe problems as hyperactivity, antisocial behavior, and in some patients it even gives rise to schizophrenia, because heat and phlegm are the main problems behind Dian Quang. So if they have this phlegm pattern, take them off wheat. It's worth doing. You might be wrong in that, but if you take them off wheat, it won't injure them at all. It has the possibility of saving their eyesight. Lung Qi Shu, well, of course, tonify the lungs, and points like bladder 13 are very helpful for tonifying the lungs. Bladder 13, lung 9. So those are the principles of treatment. It's simple once you know what the main pattern is. The trouble occurs, the trouble happens because it's not always easy to find out what the main pattern is. And so because of this, I'm presenting you now with a case history which is not completely straightforward. It's a typical case history, and I've got a number of case histories which I'm going to discuss, which are real live ones, and nearly always there's some complicating twist, something which isn't quite obvious at first sight. Before I do this, I'd like to say also how I understand these syndromes of Chinese medicine. It's when you read the books, you get the impression that liver yang rising is pure liver yang rising. They've got bulging eyes, smoke coming out of their nose, red face, wiry pulse. Well, first of all, it's never, well, in my experience, it's never usually as clear cut as that. But secondly, there's always something of the other syndromes there as well. There's always something of every one of the other syndromes there. And the key is to decide which is the most important. It took me some time to realize that this was really the case, but actually it's there in the very first lecture you have about Chinese medicine, about yin and yang. How is the yin and yang described? In all yin, there is always a little bit of yang. In all yang, there is always a little bit of yin. In ocular hypertension or glaucoma of liver yang rising, there's always a bit of kidney weak, always a bit of spleen deficiency, always a bit of phlegm, always a bit of lung problem. But what is the most important? What is the key one to go for? Don't make a stew of everything. Go for the main problem. And so I'll illustrate that by reference to this case history which we've got here. Looking at this case history, it's about Mr. G, who is age 68 and still very active. He had acquired glaucoma when he was in his early 40s, and that had been treated with drops. Gradually, the body became accustomed to the drops, and the pressure started to build up again. About 20 years ago, in his 50s, he had a trabeculotomy, but even this didn't reduce the pressure enough, and the pressure continued to rise. By the time he came to see me, the pressure was quite high, and he was getting more and more blind. So it's where can he turn? He's come to me as it were, a last resort. He's still very interested in life. He's just as busy now as he was before he retired. In fact, if anything, more so, because his hobby, which he did before in the spare time, is now an all-consuming passion for him. What does he look like? He's tall and thin, with a wiry body and thinning white hair, and slightly purple face, and his eyes are bright and enthusiastic. Well, that's what you'd expect of a person who chooses to be busy. Now, what about the examination? The energy in his back, in his lower back, was quite weak. This is something I will always do when examining people with glaucoma now. Why do we examine the lower back? Because the area around about bladder 23, bladder 24, bladder 25, that's a very good indicator of the overall kidney energy in the body. I mean, sometimes you can look at somebody and say, oh, that person's clapped out, finished, exhausted. But somebody like this, who's got bright eyes and enthusiastic, you're not so sure, but you've got to check out. And actually, his back was weak. It had those, you could see the muscle standing out on the back, which is characteristic of weakness. If you ran your hand over the lower back, you could feel that the chi there was somewhat weak. So that's something I always do in glaucoma, or if there is one of the patterns is kidney weakness. It was tender at Sanjiao 17, the Yifeng point, especially on the left-hand side, and it was especially on the left-hand side that his high pressure was bad. Slightly tender at gallbladder 20 also. So we know now that there's some local stagnation as well. This is all good, because if there is local stagnation and there's kidney weakness, well, already there's something we can treat which we know will help. What else do we know? 2 years ago, he was diagnosed as having high cholesterol. Well, high cholesterol, you can think probably is a phlegm condition. It may even be a thick phlegm condition. Of course, you should be wary of making a direct connection between cholesterol doesn't equal phlegm, but you can start to think in those terms. Otherwise, he didn't describe any major problems, any major health problems, except last year he had a period of diarrhea when he had to get out of bed early in the morning in order to pass stools. Well, what does that mean if you have to get out of bed to pass stools? This is the so-called cock-crow diarrhea, which is due to kidney deficiency. Now, where are we? We've got this person with bright eyes and kidney deficiency. Bright eyes, purple face, which you might think of liver rising or fire rising up, but he's got these signs of kidney deficiency. How does it go on from here? Pulse. The pulse is a wiry pulse. Oh dear. But the wiry pulse, in fact, is wiry on both sides, or slightly more slippery on the right-hand side, slightly more wiry on the left-hand side, but quite strong pulse, wiry and long. And it's stronger in the third position. I'll come back to that later on. The speed of the pulse, when he first came in, it was 60 beats per minute, but as he sat down, it gradually subsided to 54 or even 52 beats per minute. The clinical significance of this is that his heart is weak. This doesn't mean that actually his heart is physically weak or something that you'd find on an orthodox test. It means that the chi of the heart has been weakened a little bit. Then the tongue, when he put his tongue out, the tongue had a rough coat to it, characteristic of a liver problem, but it also had this very sticky saliva, characteristic of the thick phlegm. So here we are, we can more or less rule out the lung problem, no signs of lung problem. Spleen, his appetite was okay, but definitely thick phlegm. We know that there's thick phlegm from this sticky saliva. That means the thick phlegm means that the fluids are very, very thick, and so they're not going to flow easily out of the eye. But we can also say that there's likely to be a liver-yang condition, and there's pointers towards a weak kidney. What are we going to do? Which one should we go for? Which is the most important thing here? Well, my opinion on this, and of course different people will come to different opinions, and when you're actually in the clinic, different people see different things. But my opinion here was, it was very much influenced by the pulse. When the third position pulse, the chirp pulse, is too strong, what it means is the person is driving themselves. They're using their willpower to go to push, to go on and do things beyond really their capacity. I saw it first when I was training in an old person who'd married a young wife. I remember my teacher, Dr. Van Buren, saying, "Oh yes, she's tiring him out," and with a knowing look. And one can say that when the third position pulse is too strong like that, it means that they're using their willpower, they're driving themselves. And of course, that's exactly what this person was doing. He was driving himself. He's 68. He should be thinking, he should be slowing down. Why is he working so hard? What's going on? He's working so hard, he's blinding himself. There's something he's not looking at. He's burying himself in his work when he should really be preparing for retirement and ultimately preparing to die as well, instead of driving himself to get the last excitement out of life. And so it was. I decided that it was tonifying was the main focus of treatment here, and so I tonified bladder 23 and bladder 18 and like kidney 3 or sometimes kidney 7 or sometimes spleen 6. Just keep on tonifying, tonifying, tonifying. Other points that I used, gallbladder 20, and of course I used Cho Ho on a regular basis. So gallbladder 20, Cho Ho, bladder 23, Sheng Shu, and points on the leg. And gradually, he slowed down. Gradually slowed down. He did slightly less work, and gradually, he actually became happier. He's actually stopped driving himself with this frenetic energy. And yes, it preserved what eyesight he had got. It stopped deteriorating. The pressure did go down to sort of manageable level. How long did it take? Well, it took about 6 months before these changes took place. That's the time that it takes. If you want to change the kidney energy, of course it takes time.